Everyone, I am Ghada Badr Al Hdethi, and today I'll be talking about bone cancer. What is it, and its main types, and how to diagnose it, and how it can be treated. These are our goals. Okay. So, bone cancer is a serious disease that starts from the inside of the bone itself. It destroys healthy bone tissue and can spread to other parts of the body, like the lungs, if it's not treated early. Even though it is rare, it is important to understand it because it can affect anyone at any age. We have we divide the bone cancer into two main types. The primary bone cancer that is start directly in the bone cells, while the secondary bone cancer comes from another cancer that spread to the bone, like a breast or lung cancer. The primary type is less common but is more dangerous and aggressive. So, what are the risk factors and who can get the bone cancer? Bone cancer can happen to anyone, but it's seen more in teenagers and young adults, especially when bones are growing fast. It is actually very rare, less than 1% of all the cancers. Some things can increase the risk of getting it. For example, certain genetics problems like maturation or previous radiation exposure or a disease we call it Paget disease. Also, very fast bone growth or long-term bone injury can increase the risks. These don't always cause cancer, but they make a person more likely to get it. Now, these are the three main kinds of bone cancer: osteosarcoma, chondrosarcoma, and Ewing sarcoma. Let's go deep in it. Osteosarcoma is the most common primary bone cancer. It usually appears near the knee, as you can see in the picture, or the upper arm in younger people. It grows very fast, which is why early diagnosis and treatment are very important. The second type, which is chondrosarcoma develops from cartilage, the soft part of the bone. It mostly affects adults and grows slowly, but the problem is that it does not respond well to chemotherapy. It often appears in area like the pelvis or the shoulder, as you can see in the picture. I highlight them in the skeleton. The third kind, which is Ewing sarcoma. Ewing sarcoma mostly affects children and teenagers. It can start either inside the bone or in the soft tissue near it, like a muscle. It is known for spreading very, very fast, especially to the lungs or other bone. Now we know what are the types. Now we should know what are the symptoms that I can see on the patient. The main symptoms is continuous bone pain, especially at night. The area might also swell or form a lump. Sometimes the bone will become more weak and break easily. In advanced cases, the patient might feel tired, lose weight, or have a mid-fever. You might be wondering why the pain worse at night. Many patients feel the pain more at night. That's because the body is in resting mode. The blood flow will increase. The brain isn't distracted by any other things. So the pain will feel stronger and clearer. Now I know the symptoms. Now, what should I do to make a diagnosis? To diagnose a bone cancer, doctors start a full medical exam and then use imaging tests to look at the bone. The X-ray is usually the first step. It can show bone destruction or any abnormal new bone forming. The MRI shows how big the tumor is and whether it has spread into a nearby muscle or a soft tissue. And the biopsy is to confirm the diagnosis. It is the most important step. The doctor is going to take a small tissue from the cancer and then put it under a microscope to know which type is it. And these are some imaging examples. X-rays and MRI scans helps the doctor to see how the tumor is, how big it is, and how it has spread to other areas. Now we want to know what are the complications. If the bone cancer isn't treated early, it can cause serious complications. The bone will become more weak and break easily, and it can spread to another organ. And the patient may suffer from long-term pain or difficulty in moving. The prognosis or the outcomes, it depends on how early the cancer and which type it is. If it's detected early and treated properly, the survival rate and quality of life are much better. So now I know how to diagnose. Now, what is the other step? The treatment. Bone cancer treatment usually combine different methods: surgery, chemotherapy, and radiotherapy. The first one, which is surgery. Surgery is the most important step treating bone cancer. Thanks to modern techniques, in the past, they used to remove the whole bone that is infected. But nowadays, we have a technique we call it limb sparing surgery. The doctor is only going to cut the infected part. The second part, which is chemotherapy. Chemotherapy uses strong medication to destroy the cancer cells in the body. It usually given before the surgery to make the tumor smaller, and after the surgery to stop it from coming back. It is painful because it is strong medications. It can lead the patient to have alopecia, which is hair loss. Radiotherapy and targeted therapy. Radiotherapy uses powerful energy to kill the cancer cells. It is often used when surgery isn't possible. There are also modern treatments like targeting and immunotherapy, which focus only on the cancer cells, and it have some side effects. Now, what are the prevention and the follow-up? What should the patient do? There is no specific way to prevent bone cancer, but early checkups can make a big difference. Anyone who has long-lasting bone pain should visit a doctor early, and I mean that. And after the treatment, follow-up visits are very important to make sure the cancer doesn't come back. In short, bone cancer is rare but serious. Early diagnosis and modern treatment can save lives, and a regular follow-up helps prevent it from coming back. These are the references I used, and thank you for your listening. Stay healthy.